Hello, everyone. It's April the 20th, and this is our briefing. And unfortunately, we've got a lot of stuff again to talk about. I want to tell everyone that I always lead off with the respect for people that we've lost. You know, when I talked to you on Friday, we had lost 13 people. Now we've lost 24. And just to go right down the list, we've lost a 85-year-old lady in Wood County. Our 15th and 16th deaths were a 74-year-old woman and a 91-year-old woman in Wayne County. Our 17th and 18th deaths were an 83-year-old man and an 88-year-old woman in Jackson County. The 19th death was a 69-year-old man in Hampshire County. The 20th death was an 80-year-old male in Kanawha County. 21st death, an 85-year-old woman in Monongalia County. The 22nd to 23rd, 24th deaths were a 78-year-old lady, a 79-year-old lady, and a 95-year-old lady, all in Jackson County. 5 of these deaths were affiliated with a nursing home in Jackson County. And, you know, West Virginia continues to pace at a rate that is phenomenally good. You know, if you look at the national statistics, where we've now exceeded, I think, 41,000 deaths, and if you just think about that, and you were to proportionate that to every state, that would work out to 800 per state, and West Virginia has 24. And from that, we ought to feel like we should celebrate, but there's no way to celebrate this in my book. You know, I hate it. I hate it for the families. I ask you to join Kathy and I in prayers for all these great people and all these wonderful families, and it's just tough stuff. That's just all there is to it. I commend. It's amazing to think of just this. We have 7 counties in the state of West Virginia that we still don't have a positive case. And those counties are Pendleton, Webster, Clay, Calhoun, Gilbert, Ritchie, and Doddridge. And the reason I'm straining because I can't see very well. And Braxton is right in the middle of all of them with 1 case. I mean, it's amazing. And so not only are we doing good stuff there, we're doing good stuff in lots of places in this state, but I keep going. I go back to this. Please keep these people in your thoughts and prayers. And this terrible disease is nasty stuff. We've told you that over and over and over. And we have an elderly population, and you can just go right down the list here. All these people that we've lost are from age 69 to 95. And so this terrible disease can attack younger people, but it's really bad on our elderly people. So continue, to stay the course, West Virginia, and please, try as best you possibly can to do all the things that we've been telling you to do over and over and over. And you've done good stuff. I guess the next thing, I'd like to talk to you about is just the nursing home situation in general. On March the 12th, we suspended all visitation to nursing homes, and we were way, way, way ahead of the curve. We were one of the only states that did that, and then we directed the National Guard and the DHHR to work together to ramp up all of our testing capabilities. You've got to remember in the times of March the 12th or those days along in there, we had no testing capabilities. So no matter what we would have wanted to have done, we couldn't have done it at that point in time anyway. So then we start stubbing our toes. And we really, just to tell it like it is, we get some inconsistent data that comes to me. Well, all of you know me well enough to know that, I'm going to try to protect everybody to my last breath. And so last Friday, I directed the National Guard to test all the residents and all the staff at all the nursing homes. Now, that is a monumental task in itself because there's basically 28,000 people that are in the nursing homes and or the staff. And so to test 28,000, when you've tested for 40 days, all you've tested is 22,000 in 40 days. To test 28,000, well, how long is it going to take? How long is it going to take? Well, I've been assured over and over and over from our National Guard and from the DHHR that we can accomplish this in a week. Now, if we can accomplish this in a week, it'll be an incredible feat. But I tell you, West Virginia, we're going to come back with data, as sure as I know my name. It's not as good as what we want it to be. But what it'll do, it'll lead us to saving a whole lot more lives. We're the only state in the country that said that they were going to test all the nursing homes and all the staff. It's great, but it's still not great enough until we save every life that we can possibly save. I go back to just over and over the same thing. This is a dreaded disease, and it is absolutely targeting our elderly in every way. We're doing everything that I know that is absolutely physically, morally, and spiritually possible. And so what we're going to do now is a task that no one has ever taken on, but we're going to have data. We're going to have real live data that we hope will absolutely help us to be able to isolate and treat and take care of people maybe that don't even have symptoms yet and everything. And so our people have already started this process. They started this process this morning, and we'll move as quickly as we possibly can. And I've been assured that we're going to accomplish this task sometime. We're going to finish it this week. Now, at the Elder Care Nursing Home in Jackson County, we have 55 laboratory confirmed residents that are positive, 16 of the staff out of 92, and we've lost 4 people. Okay. Let me just jump around just a little bit and tell you one other thing. We lost a legend. A lot of you know Cal Bailey. I sure knew of Cal Bailey and watched him win 1,063 games, in his coaching career. He ranks 11th in the NCAA among Division II coaches in victories. He is also 30th in the winning percentage with 67% of his games that he coached, he won. And we lost him yesterday at the age of 77. Cal Bailey, Coach Cal Bailey, please rest in peace. I know you're you're coaching a great game right now, and your pitcher's winning the game in heaven. So God bless him and his family in every way. We have an executive order. Well, let me talk, to you about. I want to just touch. I'll bring this all together at the same time. Okay. There's surely a balancing act that is unbelievable that has to be done between restarting the engine or reopening West Virginia, reopening the United States, restarting the engine of the United States, or trying to stay home, do everything we can to protect in every way. Now, listen to me on this, because I really think I know what I'm talking about here. From the standpoint of our president, from the standpoint of all of his people that are around him, here's what I think they're faced with. They're faced with just this. If we continue down the path that we're going, and we have to if that's the only safe recourse, if we continue down this path for very much longer, there is a real possibility that the engine won't start back, or the engine won't start back in a way that will assure us to not drift into not a recession, but the possibilities of a depression. If that were to happen, we will lose lives like you can't imagine. It is a very difficult decision for our president and his people, and they're handling it very well. But it's also a really difficult, position and decision for me. I'll handle it to the very best of my abilities, and let me tell you what we've got to do. We have got to start the engines back. We have got to start back, and I will assure you that we will start back as safely as we possibly can. But there's no possibility that we can avoid 100% of the risk. There's risk on both sides. There's big risk. And we're going to have to depend on you, the good people of West Virginia. We're going to ease ourselves back into restart. We're not going to run back into the restart, and we're not going to run back into the restart because I'm going to protect you as best I possibly can. One of the things that we have to do to restart, the beginning thing to me, is we've got to restart our hospitals. We've got to restart from the elective surgeries and from the general care that maybe you've been laying to the side that you need to do. Because if you don't do some of those things, we could very well lose you too. So what I'm going to do by executive order today is say to our hospitals to start their preparation and start their preparation to be able to go back, and to be able to go back on the 27th, if the 27th of April, if they meet a certain criteria. And that certain criteria has 4 or 5 different steps to it that I'm not going to elaborate on right here, but they have to then submit to our DHHR, and we have to be satisfied that they are in a position to be able to protect our people. They have all the protective gear, they have all the supplies, they have everything, and they meet that criteria, and then we will approve them going back to work. So, what I'm really saying is this: not on April 27th, people are going to go back. On April 27th, they can start submitting for our review, and then from that point forward, we will decide, yes, you're prepared, and no, you're not. Beyond that, there's lots of different things to consider and everything, and we will continue to crawl before we run and make the best decision that we can make to assure your safety as best that we possibly can. I want to say this to the world. Now, this is important to say to the world. And I may be criticized to say that this is marketing West Virginia, but honest to goodness, that's what I want to do all the time. I want to be proud of who we are. This pandemic has been catastrophic to the world in lots of different ways. West Virginia is a place that people really haven't realized just what level of incredible expertise that we have here. We got smart people here, really smart people that are innovative in every way you can imagine. They're craftsmen, they're super smart, they're hardworking, and they're really good people. Now, with all that, one of the things that we're going to do in the state of West Virginia is we're going to become self-sufficient. we're going to be able to make our own stuff right here as far as being able to supply our hospitals, whether it be testing kits or masks or whatever it may be. All of that innovation is saying a message to the world, and that is just this. Why not West Virginia? Why not come to West Virginia and let the plants be in West Virginia where they're apart and they're not jammed in a city where where everything is just so exposed to the next terrible thing that may happen. West Virginia is a place that abounds in smart people. It abounds in innovation. It abounds in craftsmanship. It abounds in distancing. So I couldn't be more proud of the fact that West Virginia, we're going to work on our way, and you've already seen it. You've already seen what's happened in West Virginia from the standpoint of us rebounding and our guard producing and doing all the different things that has been done. You've got to have been able to see us step up and step up and step up. One of my sheets right here, it shows that one of the things, and the reason we're a little late today is the vice president's call went on a little longer than we thought and everything, but every Monday we have a call. Sometimes it's 12 o'clock, sometimes it's 11 o'clock, but this one was just with the vice president. Sometimes it's with the president and the vice president. But it went on longer than what we thought and everything. But one of the things that they mentioned there was the United States has a case fatality rate of a third on the number of cases that were tested, deaths per test, a third of what Italy and Spain were. Now, the beauty of all this is, well, where does West Virginia fall? West Virginia falls at a rate of half of the United States. So the net of the whole thing, and that is all gauged on population, the amount of population. So the bottom line is just this. You have done really good. For those 24, we continue to have them in our prayers, our thoughts, our feelings in every way. But West Virginia, you are the place where people should come. You are the place where the manufacturing should be. You are the place that abounds in innovation and smarts. You're not the place that used to be 50th and that we've forgotten about forevermore. You're the new place, West Virginia. You're the place where I think everyone should be. So keep doing the stuff that you're doing, and we'll get through this. We'll take baby steps in starting back, and those baby steps will be done on the advice of our experts. They're not going to be done on the advice of anyone that's pushing us to do something that may endanger you. So that's, I guess, about all I've got right now.
All right, thank you, Governor. We're now going to take comments from a few of our panel members. Up first, we have Scott Adkins, the Director of Workforce West Virginia, joining us today. Scott?
Good afternoon. The dedicated men and women at Workforce, along with their partners, including General Hoyer and the National Guard, have taken more than 140,000 unemployment claims since March the 16th. We've also fielded more than 100,000 phone calls. The automated system at Workforce has fielded over 500,000 calls from unemployment claimants. Eligible unemployment claimants have received more than 137,000 weeks of the extra $600 benefits from the CARES Act, totaling more than $82 million. And thanks to Governor Justice's leadership, West Virginia was the first state in the union to pay the extra $600 benefit. Workforce is committed to being responsive to the needs of COVID-19 affected West Virginians, and at the direction of Governor Justice, Workforce is working around the clock, 3 8-hour shifts a day, to ensure every eligible West Virginian receives their benefits timely. All eligible, this is good news, all eligible backlog unemployment claimants without claims issues will be processed by Wednesday night. That's a huge undertaking for us. The pandemic unemployment assistance offered by the CARES Act provides benefits to workers who would otherwise not be eligible for unemployment compensation benefits. That includes self-employed workers, independent contractors, workers with insufficient work histories, gig workers, Uber drivers, Lyft drivers. Those folks will be able to apply for the pandemic unemployment assistance by 10 p.m. this Friday, April the 24th. PUA eligible individuals will need to apply online at workforcewv.org. So for you folks who are self-employed, independent contractors, you're going to have the opportunity to apply for benefits starting this Friday night. Also, those folks who apply Friday night, the benefits are retroactive. So from the weeks of March 29th and forward, you'll also be eligible for the $600. If your business was hurt all the way back as a result of COVID-19, all the way back to January 27th, you'll be eligible for benefits. So again, to apply for those pandemic unemployment assistance benefits, Friday night after 10 p.m. at workforcewv.org. If that portal opens up prior to Friday night, Governor Justice will make that announcement. Thank you.
All right, thank you, Scott. Up next, let's go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. We have 646 National Guard personnel on duty. They've completed 502 missions. Some of the highlights you'll see this afternoon in our press release later this afternoon. Over the weekend, 27 retail locations received training. Additional locations will be trained today. 11 nursing home long-term care facilities will receive additional PPE training. This is part of the governor's initiatives related to both the testing and the other support needed to protect our most vulnerable population, particularly in our nursing homes. You'll also see a significant number of meals and food boxes delivered by both the efforts of the county, school boards, the National Guard, and the food banks and VOAD. In addition, this afternoon, we begin testing at the two state veterans nursing homes, nursing facilities. That will be followed tomorrow by additional training and sanitization support at those facilities. Again, at the governor's direction, we've been tasked to not just train, but also provide support for sanitization and other ways to reduce the spread of the virus, as well as provide additional PPE training to better protect not just the residents of the facilities, but also the employees. On behalf of all the men and women of the National Guard, as pointed out by the governor, we've made some great progress. And all of us appreciate the work that's being done by West Virginia citizens. I would ask on behalf of those guardsmen and their families that we continue to stay focused, we continue to double down, and we do the things that are important to make sure that we as a state lead the way in beating this threat, this coronavirus. Thank you.
All right, thank you, General. Up next, let's go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. It's great to be with everyone today. As the governor has stated, that we are very enthusiastic about reopening our capacity to take care of people who have put off having procedures done and getting medical care during this COVID pandemic. Our hospitals, CEOs, hospital associations, state medical association, physicians, nurses, other folks have done an incredibly responsible job in preparing and being ready for the potential for a surge. And because of the great work of each citizen, we have not seen that. In fact, as the governor articulated, we are among the best states in the country, and that is really due to you. So opening up the hospitals for healthcare and the physicians and the nurses and the healthcare workers is really important. I want to make two comments about the support that we want to give these brave workers. Number one is we know one of the secrets to getting ready to expand and reopen parts of our economy. And at this point, as the governor said, we think that the hospital and healthcare sector is the right sector to start to open, that we need to have expanded testing capability. As we've talked about, There is at least half people that can spread the COVID virus can be pre-symptomatic. So in order to both protect the workers and also to identify the people who have had infection and have immune response, we have both enhanced the ability of our own laboratories in the state by acquiring 30,000 more swabs and 15,000 kits to be able to use to get the samples and to do the testing. And in addition, we have made a larger collaboration with LabCorp, which is a national testing agency. And in fact, to our wonderful surprise, the president and lead person, chief medical officer of the entire LabCorp organization is a native son, Brian Cavaney, who is a physician and a lawyer, and got both degrees from West Virginia University, and then got a master's in public health from University of North Carolina at Chapel Hill. Brian and his team have committed their resources and support to be able to broadly expand testing in West Virginia, working collaboratively with our state resources. And that's going to be a very important addition to safely opening up hospitals for surgeries so that we can support the testing of people coming in and support the testing of people who work in high-risk areas. In addition, as the governor said, that we are committed to becoming self-sufficient. And so as we look at our personal protective equipment supply, we continue to create and make our own, which is going to really underserve the opportunities that will be given by the hospitals and healthcare sector starting to get back up to speed responsibly. We still want them to have sufficient personal protective equipment and capacity so that if we do experience more activity or surge on this sort of reactivation of the economy, we'll be in good shape to do that. And I'll just end briefly by saying, as the governor did, that we still are counting on you to do the things that slow the spread of the virus in the state, which is staying home, telecommuting, staying socially distanced, wearing a face covering out in public. If you can't safely socially distance, covering your cough, and avoid washing your hands 20 seconds and avoiding putting your hands to your mouth, to your nose, or your eyes. You're making the difference, and you know how to protect yourself, which protects all of us. So thank you.
All right, thank you, Dr. Marsh. Next, let's go to Secretary Bill Crouch with the West Virginia DHHR.
Good afternoon, everyone. Let me talk just a little bit about the executive order that the governor spoke of. And let me mention Dr. Slimp is not with me today. I asked her earlier if she'd take the point and be the lead on making sure we get this executive order done as quickly as possible. The number of facilities is 124 long-term care facilities. This does not include assisted living facilities. I know there's been some confusion about that. It is licensed nursing home facilities according to OFLAC, our Office of Health Facility Licensure and Certification. So Kathy's taking the lead on that and pushing very hard to get this done. We had a call Friday with the Association of Long-Term Care Facilities, the Healthcare Association. We had a call with the health officers, all of the health officers in the state of West Virginia, and filled them in on what we were doing. We had the call, as Clay Marsh mentioned, with LabCorp, which is very productive. LabCorp is going to help us take the lead in terms of the lab that we can use as a part of DHHR services. They're actually the backup lab for our state laboratory, so that fell in place very well. We have, to give you a little update, we have 6 facilities actually initiated testing Friday. We have 8 facilities that have begun testing today. That number will probably increase. And we have 28 facilities that have already committed to begin testing immediately. So LabCorp has the ability now. I will say they were behind for some time. They were the first lab in the country to be able to provide this testing. So consequently, they backed up for several weeks in terms of the number of tests that they were doing. They are now caught up and can provide us 1 to 2 day turnaround. They have capabilities now of doing 65,000 tests a day. So we're excited to be able to move as quickly as we can coordinate with the facilities. We've had communications with a lot of the individual providers, some of the chains, and everyone seems to be on board here for testing of all residents and all staff. So with that, let me mention one other thing. I try to talk about DHHR services that we're trying to continue and make sure we don't slow things down. Let me just mention the Office of Rural Health for 1 second. They continue to maintain federal grants that support rural hospitals. We're still getting those funds out to hospitals. Some reporting adjustments have been made to provide more technical assistance for pending increases in funding to combat COVID-19. The J1 waiver program continues to process applications, so that service, the loan repayment program, we're still accepting applications through May 30th. So if there's any interest there, please know that we're still here and still conducting that program. And staff are able and available to answer questions and concerns at our WVSORH website. So you can log on to DHHR, the DHHR westvirginia.gov website and find links to that program. So thank you all very much.
All right, thank you. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Annie Moore with WVVA.
Hey, this is Annie with WVVA. My question is, have you been able to identify whether there was a breakdown in protocol with respect to health and safety standards at the elder care facility?
I think one of our health officials probably answer it better, but Annie, let me just jump in and say, I'm not going to dodge any question. The reason that I sent the National Guard, the reason absolutely that I've put out the executive order to test everybody in nursing homes, we can say what we want, but there is and there has been breakdowns, and we can do better, and so that's why I took the action that I took. But if someone else would like to answer.
Yes, Governor, this is Bill Crouch. Let me say I spoke to the administrator 2 or 3 times on Friday and again on Saturday. What I suggested, and he has done that, is to communicate better with the community. He put out a press release on the results of the survey of the testing on Saturday. I'm sorry, that may have been Sunday. I'm not sure of my days here, but that was sent out by the facility. Communication is important. I've said to the group publicly that the long-term care group that we want to get information on the website in terms of the number of cases. We think that should be public information. I know of one long-term care provider that has placed that on their website, and that's Stonerise, who lists the number of positive cases at each of their 16 or 17 facilities. I just would encourage transparency and to be open. And one of the things that a lot of these facilities do well is to communicate with families, and that makes a huge difference if they're able to know how their loved one is doing.
All right, thank you, Annie. Next, let's go to David Beard with the Dominion Post.
Hi, David Beard, Dominion Post. In the context of the governor's remarks on reopening, I saw a report today that the University of Washington's Institute for Health Metrics and Evaluation, that model they do, projects we could start easing some of the social distancing requirements by after May 4th, if we have the appropriate measures in place. And our neighboring states are a bit later, May 18th. June 1st, June 8th. But I wonder if that model is factoring at all into your thinking, understanding it is just a model.
Let me take that. David, here's the thing. And maybe I shouldn't say this bluntly, but that this is exactly how I feel. I'm not going to let a model in the state of Washington all the way across this country, that is going to push us to doing something that's going to endanger our people. That's all there is to it. It's just as simple as that. We have to show ourselves and all of our great medical experts, as well as the National Guard and all of our people, that we're ready to move forward. I am 100% behind moving forward and getting the engine started back, because it is dangerous not to start the engine back. But absolutely, for someone, in Washington State to look at a map and say, dag, West Virginia doesn't have hardly anything that's going on there compared to a New York or Connecticut or whatever. So really and truly, I think it'd probably be fine for them to just go back to normal tomorrow. Well, we're not going to take that advice. We're going to take our own advice, and we're going to move forward as such to protect our people and get the engine back going as fast as we can.
All right, thank you, David. Up next, let's go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. I want to talk about looking at that 14-day curve that we have to watch and see those cases go down. With more tests happening, the number of positives is obviously going to go up. So is that concerning to you about the opportunity for opening things up sooner? And then also just the demand of testing. I know Dr. Marsh talked about LabCorp coming on to help with that. But we saw in the beginning, because we had such a low number of cases, getting tests in West Virginia wasn't easy. So are we going to have the tests that we need to make all of this happen? Two parts. Thank you.
Okay, Clay, I'm going to have you jump in just a second, but let me just say this. Amanda, we and the health community more than I, because they know this way better than I, but they look at a nursing home situation as one, because it's not community spread, it's at that particular facility. Well, if you look at these numbers that way, and that is a one, as far as a positive test, then our numbers are absolutely curving and skewing the right way. But beyond that, as far as the availability of the testing, the Guard and everybody's going to tell you, we're there. We're there, and we're getting better and better and better each and every day. But going back, now I'm going to let Clay jump in, but I think what we're going to say is the curve is good. We hate like crazy what's going on in these nursing homes, and even with that, we're still half or better as to what is going on with the nursing homes all across the country. But it's not good enough for me. It's just plain not good enough. We got to get better than where we are today. Now, but the curve is going good, and the testing is available. But nevertheless, I'll let Clay, you can jump in, and then maybe General Hoyer.
I think, Governor, you've just earned your medical degree. So, Amanda, I think that the governor is exactly right. We certainly want to look at community spread as the sort of a marker of the prevalence of COVID in the state. And we've seen that be very flat. We're still at 4% overall for our conversion rate. The governor I think, has been very aggressive and progressive at ordering all nursing homes and all of that tested. And as we go forward, we want to continue to look at the vulnerable populations in the state, because right now, even though we have a relatively smaller number of deaths in our state versus almost any other state, we know that a relatively big percent, about 45 or 50% of those deaths are from people who are in nursing homes. And we know that age of over 75 is a huge risk factor for ICU and death in COVID-19. So as we understand the silent carriers in the nursing homes and understand who has COVID infection, we can do a much better job of isolating them and be able to care for them. So overall, our numbers still look very good. Yet at the same time, we know that it's not time to let our guard down, and we need to continue to do exactly what we've done to keep the spread of the virus down as we start to look at what sectors might be able to come back online.
Okay, thank you, Amanda. Up next, let's go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Regarding the elective procedures and the need to do enhanced testing, are we talking about testing every patient prior to their procedure, and exactly how many additional tests would that ballpark amount to?
Clay, that's you.
All right, Governor. So, Phil, thanks for the question. I think that what we will do is we will stand ready to work with each one of our hospitals and hospital system and healthcare system to define how they want to approach this. Certainly, as we look at people who are getting procedures, surgeries, who may need to have a breathing tube put in during the surgery, many people will feel more secure that they know that that person is tested negative for COVID, so that they don't have to take the same cautions and understand that they have to take care of that patient in a different way. So I think that's important. Certainly we want to pursue universal protection for people, and that's important as well. When we look at the numbers that could be, then we know from our own labs here in West Virginia, plus the commitment from LabCorp, as Secretary Crouch said, they can test up to 65,000 people a day, that we will have plenty of capacity to test whoever we think needs to be tested in the state. And as we start to expand from just doctor's orders and that group to looking at supporting hospital operations and bringing antibody testing, which is a new kind of testing, to West Virginia, which we're committed to do, that will start to open up new opportunities for us to protect our citizens better and to augment our ability to respond quickly if there is an identified case, to understand how much is that spread.
Okay, thank you, Phil. Next, let's go to Don Smith with the West Virginia Press Association. Okay, we'll try to connect with Don here in a minute. Let's go next to Kenny Bass with WCHS.
This is Kenny Bass with Channel 8 and Fox 11 in Charleston. I have a question for either the governor or Clay or even General Hoyer or perhaps Bill, whoever is best suited to answer. West Virginia is not an island. And so how much will it factor in where every state surrounding us is having a much more serious impact of the COVID-19, both in cases and in fatalities? How much will that influence how West Virginia can reopen while dealing with concern that people do cross borders very freely, continuously, and there is the opportunity that some of our surrounding states could have an impact on what's going on here?
Let me start, and then if you guys, if there's something that I've missed, jump in, please. But Kenny, it's a good question. And it's a legitimate concern, and it's on all of our minds as we meet and talk constantly. I think the backup to the whole thing is just this, and I guess this is the most impactful thing that I can say in regard to this. We're going to have to learn, at least in the near term, we're going to have to learn how to live with this disease, because it's not going to go away just tomorrow. We're going to have to live with this disease until we bridge ourselves to drugs that are able to stop it or vaccines. Now, and that's not going to be tomorrow. We can't shut the engine down for 6 months, because that could very well put us into a situation to where it would be far, far worse than where we are today. So what do? We prepare ourselves to be able to test to magnitudes that we can't even imagine today. We prepare ourselves to have a strike force and to be able to identify and isolate if we have outbreaks and everything. And we also prepare ourselves to have more knowledge about antibodies and things like that can protect us. From the standpoint of worry, about what's going on in a neighboring state and them, possibly drifting across our borders, we're going to still be aware of that, and we're going to try to absolutely be on guard as best we possibly can for any situation that would arise. And we're going to take baby steps instead of giant steps to get ourselves back to work.
Okay, thank you, Kenny. Next, let's go to Mark Curtis with WOWK.
Governor and others, today it occurs to me today is April 20th. We're 10 days away from the target date for schools not to be open. You're giving the hospitals a week's heads up to get prepared and apply to start elective surgeries. Aren't you going to need about the same lead time for the schools to get them prepared to open up again if they are next week? Are we nearing a decision on that?
Mark, I just got through with a meeting with Superintendent Birch, and Clayton is on top of this in every way, and I think you'll be hearing from us real soon, as to what the next steps are going to be. It's the one thing that I would promise you, as I've promised you over and over, I surely have been hopeful that we could go back to school. I want us to be able to do that if that's at all possible, but at the same time, I've said repeatedly over and over and over, I will not in any way, put kids back in a situation that could cause a potential problem for the kids or, parents or grandparents or whomever it may be. And so you'll have a decision coming out on that and very soon, very soon.
Okay, thank you, Mark. Next, let's go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Sorry, unmuting there. There was a New York Times story over the weekend that cited research from Harvard laying a number to the amount of testing that has to be done to serve as our radar for the amount of this virus that's out there. The number they put to it was 152 people tested per 100,000 population. Does West Virginia measure its testing that way? And can you give me a better feel by numbers for West Virginia's testing capability versus where it needs to be, to actually put a number to that?
Well, Brad, I'm going to say this, I'm going to pass this to Clay, but before I pass it to Clay, I'm going to say to you that testing 152 per 100,000 isn't good enough. That's not good enough for West Virginia. And so we're moving, and I don't want to steal Clay's thunder and everything, but we're moving in a direction to where at some point in time, we'll be able to test every person in the state of West Virginia. And that every person is every person, if need be. But we're moving in those directions. But Clay, jump in here because you know more about this than I.
Well, thank you, Governor, and Brad, thanks for your question. When we look at our capacity is, I believe, and I did get a document from the general earlier that quantified that, but is somewhere around 4,000, 4,500 with all the supplies we have on board in the state without LabCorp, and about 6,500 just maximal capacity in a day. But with support, we believe, as the governor said, that we really don't have limits on the capacity that we would need to test people that we believe should be tested. And I think that as we look at moving past limited testing where we have to have everything done symptom generated, and we realize now that many of the people that are passing COVID forward have limited symptoms or are before their symptoms, then we know in areas of more concern, vulnerable populations like the governor did with the nursing home population, as we extend this to other populations, that screening these populations for asymptomatic infection turn out to be really important because of the person-to-person spread capability. As we start to look at hospital sector coming back, we may want to test those people with the COVID test, but also we might want to test the physicians, the nurses in the vulnerable areas like the emergency department, the ICUs, the first responders, we might want to test them to see if they have come into contact with COVID and have gotten better, that have immune response to that. So we believe today we don't really have effective limits on what we need to test. If you said, could we test the whole population of the state today? You know, as Secretary Crouch said, LabCorp has a capacity of about 65,000 tests a day, and we have a capacity of maybe 4,000 to 6,000 tests a day. So as we go forward, we could do it in bites, but right now we don't think that that's required nor indicated. But we are confident that we have the capacity we need to test West Virginia.
This is Bill Crouch. Let me jump in 1 second. The fact that we are the first state to test every resident in every nursing home in the state and every employee of every nursing home in the state is really such a proactive move from the standpoint of what other states are doing. So when you look at testing per population, we are going to continue to move, as Clay said, in that direction, the direction of testing more people. The governor's laid this out from the very beginning and kept us in front of the curve as well as flattening the curve. And we're still doing that. I just learned last night that CDC is actually considering requiring testing of nursing home patients across the country. I didn't hear anything about employees, but if that's true, it shows again that we're in front of the curve and the governor's being proactive and making sure we're doing things we need to do to keep everyone safe and reduce the number of deaths.
And I'm just going to make one more comment and I'll stop. So I just got the slide. So currently we do about 2,500 tests a day, 17,000 a week. Our potential in state is 4,566 a day and 31,900 a week. And that's not with LabCorp.
Something to it too. And you know, Brad, you wanted a number and everything. And just think about this. If we accomplish in this next week, you know, that we're talking about here, the 28,000 or so tests at the nursing homes, at that point in time, we'll have tested 50,000 people in the state of West Virginia. And 50,000, if you were looking at per 100,000, we've tested 50,000. We've tested, you know, per 100,000 an equivalency of a population of 5 million people, I think. I think that works that way, you know. But if that be the case, you know, if those mathematical numbers are right, we're already, with just that 50,000 tests taken, if I'm doing the math right, and I could be doing the math wrong and everything because I'm just doing it on the fly, but I think that equates to 5 million people in a state that has right at 1,800,000 or 1,000,000, high 700,000. So, and we're just going to keep testing and testing like crazy to isolate and be proactive and try to do all we can possibly do to stay where we are on this curve on the low end and with the least amount of deaths that we can possibly end up with.
Okay, thank you. Next, let's try Don Smith again with the West Virginia Press Association. Don, are you there now? Okay, I think he's still having some audio trouble. That's okay. We'll go now to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I was wondering if you could tell us anything more about the guidance from the federal government for how the state can use its stimulus dollars. You said on Friday we'd receive about half of what we think we should. Do we know any more yet about what we can do with that and how?
Charles, we don't have the rules yet. But I say that, but we got the money, you know, and Charles, the net of the whole thing is we're hopeful. We're very, very, very hopeful that we can backfill the revenue, you know, but there's a lot of mechanisms here that we're going to be able to do. Now, and while you brought that up, I wasn't going to do this till tomorrow, but while you brought that up, because I just found out about it, you know, we had $625 million that came into a bank account last week. Now, everybody has been just paranoid beyond belief, and bombarding me nonstop with the fact that what are we going to do? What are we going to do? You know, the state's running up an incredible debt. We've got so much money in rainy day. We're going to have to invade rainy day. We're going to have to take the Medicaid reserve money. We're going to have to do this. What are we going to do? We're going to have to lay off everybody under the sun and terminate them, take their benefits, do whatever. What are we going to do? And I kept telling everybody, I said, you know, now this gets back to Jim just being folksy in his language, but just being like, I've told you many times about walking through the woods and you look and 10 feet away from you is a rattlesnake. What do? Well, you stand still. You look to your left and look to your right and look behind you, and because that snake can't bother you there, and then you determine a course to go and go. Well, I told everybody, stand still. This stimulus package is on its way, and it's real money, and we're going to be okay. We're not going to have to lay people off. We're not going to have to cut stuff. We're going to be okay. Because absolutely, you know, I'm in contact with the president all the time, and I know we're going to be okay. Now, do we have the rules yet to absolutely know for sure we can backfill? No. But the thing that is unbelievable is they sent us $625 million last week. But you know what else? They sent us $625 more million today. So right now we've got in that bank account $1,250 million. We're going to be okay economically from West Virginia without any doubt.
All right, Governor, I'll turn it back to you.
Okay, let me just wrap it up and say just this, that yesterday we had a meeting at the mansion and went over a whole bunch of things, you know, in regard to where we stand at the nursing homes, where we stand with the testing, how we're going to get everything done and all this kind of stuff, and with many of our leaders and everything, and in phone contact with others. But you know, basically what came out of that was a lot of good stuff. But one of the things we were surely discussing was the reopening and how we're going to go about doing that. You know, I want to just tell you just this, that, you know, we're the only state in the country doing lots of things, but we're absolutely the only state in the country that has sent the National Guard to businesses to train them on how to use their PPE and how to teach them proper disinfecting protocols and everything. Well, only state in the nation that our Guard's done that. And our Guard's done all kinds of wonderful stuff. We know that. But the only state in the nation that's done that, and we're the only state in the nation that the Guard has a mobile testing lab. Now, a lot of people are pushing us and say, well, you're the least burdened state now because of all the good things you've done. But I caution everybody over and over and over by saying just this, we're the highest risk state of all. You heard me read the ages of all those that we lost. We're the most elderly, the most chronic illnesses. We absolutely have to stay right on top of our game all the time. Now, Dr. Clay Marsh said just a minute ago, I answered something. He said, Governor, you got your medical degree now. Well, that's the last thing in the world that I want right now. And you know why? Because, of course, first and foremost, I've got to do my job. But those people that have their medical degrees, whether they be our nurses or our people that are working in our hospitals or our doctors or whomever it may be, first responders, whomever it may be, they're heroes beyond belief, what they're doing right now. They're right out on the front lines, and they're just knocking it down right and left, and they're absolutely exposing themselves and their families in every way to a disease that is off the chart. So I commend them, and I love them, and I thank them from the very bottom of my heart, and I'd end by just telling you just this. Of those that we read that we lost, we can't read their names because of whatever the regulations may be. But every one of them has a name, and every one of them has a family, and every one of them has a lot of loved ones and friends. So just remember that, and just keep them in your prayers, and let's just keep going. We're going to be okay, but it's tough stuff. But without you, we can't make it. But I thank you in every way. God bless.